Stanford Health Policy is a community of researchers at Stanford that are studying some of the most compelling and important problems in health policy. Our aim is to improve health through informing better health policy.
We are focused on the weighty healthcare issues that affect people from cradle to grave.
One of the great things about Stanford is the interdisciplinary approaches we have, the number of people coming from different perspectives, from law, from economics, from business, from the clinical side, working together. And it really makes things work better. It makes us able to come up with better ideas and see things from different perspectives that can, we think, make a real difference in the research that we do.
One of the things that I really enjoy about health policy is often the questions they're very challenging and they don't have straightforward answers.
How safe is care and what's the quality of care?
How can we care for the poor in a way that's sustainable?
How do we help children living in countries plagued by conflict, chronic violence, and weak governance?
How does the Affordable Care Act affect health outcomes in the United States?
At Stanford Health Policy, we have two main missions. One is a research mission to explore health economics in all its facets, and the other is to train people to be able to do the kinds of work we do.
We're part of the Freeman Spogli Institute for International Studies, which addresses policy questions very broadly in the international realm. And we're also part of the School of Medicine and the Department of Medicine, which both delivers health care and has very active research programs.
During the course of our interview this morning, there will be approximately 500 preventable deaths to children under the age of 5 taking place in areas of political instability. If we're not saving lives, we're failing. And that sense of urgency informs everything we do.
We have a collection of health economists, decision scientists, adult medicine folks, pediatricians, surgeons. You put everybody in the same place and everybody's thinking about how to improve health.
Health law is a broad field. It encompasses policy, law, and ethics, and it is the intersection of legal issues in the healthcare system with a wide range of regulatory questions.
It's a world-class university with a world-class School of Medicine and a world-class law school, and those are hard to find around the country. In addition, it's the smallest big university I've ever seen, in the sense that although we have national and international stature, this is a relatively tight-knit community.
There is really a push to think about a particular problem across, beyond the scope of your immediate department, to really collaborate with others across the fields.
We are part of Silicon Valley, and that entrepreneurial spirit in Silicon Valley tends to have an effect on how we think.
If you honestly analyze the data with rigorous methods, you can identify problems and you can help solve these problems that are just sort of fundamental to the lives of everybody around the world.
We're looking at health policy and research and education and trying to make a difference in the world from as many perspectives as we can. We think teaching is a really important piece of that. The next generation of leaders in this area is going to be really important. The problems that we're facing are not going away, and they're not necessarily going to be easy to solve in the short run, and they're going to change and evolve in the long run.
I teach a course in cost effectiveness that's offered both for business school students, for graduate students, and for medical students, where we teach people how to understand the cost effectiveness of medical interventions.
When you're designing policy or critiquing policy, it's very important to understand the struggles of the people in the trenches, the people who are actually delivering the care.
We can sit and think about this as academics, we can make all these beautiful models, but at the end of the day, single people one at a time are going to go to the doctor or not and get these services. And if we don't think about it from that perspective too, the most beautiful ideas structured in the most elegant ways, might fail at that level.
There are two things that keep me grounded in my work. One is seeing patients, wonderful patients and families who remind me of why I went into medicine. The other thing that keeps me grounded is working with wonderful trainees, from undergrads to medical students to residents and fellows here at Stanford. And one of the things that Stanford Health Policy allows me to do is to work with them not just in clinical settings, but around research.
We're truly trying to make a difference in the world. From our students exploring medical issues in India, to our programs to help children in Guatemala, to try and improve the quality of care of our patients back home. This is what keeps us motivated.